Good evening. Welcome to ONV as we present a healthy conversation. I'm Nurse Pat, and tonight my guest is Carlos Clopton with Neighborhood Health Clinic. And I'm going to let Carlos tell us a little bit about himself, and then we will get into our conversation.
Sure, absolutely. My name is Carlos Clopton. I've been with Neighborhood Health for about 3 years. I'm the program manager. A lot of what I do is outreach related, making sure people outside of our building know about our services. They get first contact, first information about a lot of our providers, the services we offer, and a lot of the things we do within the community. It comes from me a lot of times with the outreach and that sort of thing. So that's mainly what I do. I do a lot of things more so internally, but for the people externally in the community, that's what I do more so spreading the mission of neighborhood health.
Now, I know a little bit about Neighborhood Health Clinic. The one there is located on Calhoun,
hmm
and it's been years since I've even been inside that building. But I know there are two other locations. Am I correct? And a new location is where you are. Is,
Three. Sorry, go ahead.
is it three locations?
Three
Go
other
ahead.
locations. Yeah. So Broadway, we have a Broadway location, or more so a Broadway site. Oxford site, which is the one I'm sure you're referring to with the new location, and well, also Broadway. So Calhoun, Broadway, East Paulding, and Oxford or Warsaw.
And see, I was not aware of the Broadway location. I did know of the Paulden location,
hmm
and it's out by Save a Lot. Am
Yes.
I correct?
Yes, right next to I can't think of the name of the church right now. Impact Center, right next to the Impact Center. And then
Okay.
the Broadway location is a partnership with Four Way Med Ed. So we partner with, they handle the medical the education side, the residency. I'm sorry, I'm talking too fast. The residency, and we take care of the clinic portion.
Okay. Now, with the Neighborhood Health Clinic, did you say Oxford?
Yes.
It's on the corner of Oxford and Warsaw,
Right.
the Ward School Building. Am I
That is,
correct with that?
you are correct. It was unoccupied for some time, and we decided to go in and save the building, and now it transitioned from education to healthcare. So I think that's a good story.
Now, what does the community need to know about neighborhood health? What does it offer our community?
Well, I mean, that's a good question. So we offer all of the services: medical, dental, behavioral health, chiropractic care, and pharmacy. Pharmacy just opened last year, 2024 in February. That was a soft opening for pharmacy. So these are all the services that we have available. Oh, you mean the Oxford location or neighborhood health? Period.
Period. That
Yeah,
too, and the Oxford
right.
Center.
So those are all of the services that we have available, and we want people to know that the and the community center also, in addition to all of these services. So we want people to know that we're here for the community to provide education, access to the healthcare, and we want them to know that our providers are personable. They're there to build a relationship with them, because we believe that that's the building a relationship with the provider is the foundation of good health.
Now, do you see all ages, or is there a particular age group that can go to neighborhood health?
Well, that's a great question. I know that for dental is age one, and I know it's something around there because we have pediatric care as well. So I need to check to make sure on the specific age, but I know we do everything from pediatric to geriatric. So
Oh, and like I said, I'm familiar more so with the one on Calhoun.
hmm
And I know, like I said, it's been so many years, but they had dental downstairs,
hmm
medical was mainly upstairs, and
hmm
they had, I want to say, OB and downstairs
hmm
there. And they also had WIC. Are those things still there?
as far as where they are, I don't know if those are in a precise location that you remember them at, but we still are the local headquarters for WIC, and dental is on the first floor of Calhoun, and it's on the second floor of Oxford, And you said pediatrics is on the second floor, and
Okay.
women's health was on the first floor, and we do women's health at Oxford as well. And we've added since then, and I'm not sure how long ago that was, but since then, in 2016, we added behavioral health, and
Oh,
what other service do I believe we had it? I can't think of it off the top, but I know we've added chiropractic care last year and 2023, chiropractic care and pharmacy in 2024.
now how would someone become a patient of neighborhood health?
Oh, easy. Oh, go ahead. I'm sorry. I
No, no,
want you to
that's
finish.
it. Yes.
Well, we have you have to call the number
Mm-hmm.
and you can schedule an appointment with one of our schedulers, and they'll point you in the right direction to depending on what provider you want, your availability, and some people want a specific provider because I mean, like we said, we want you to build a relationship. So if you want to wait for that specific provider, it's going to be a little bit more challenging. But if you want to just get on a schedule with
Mm-hmm.
a particular department, that's going to be, and you don't have a preference,
Mm-hmm.
especially as a new patient, that's going to be a little bit easier for you.
Now, how would I know if I've never been to your location there on Oxford?
Hmm.
How would I know to choose a provider?
Well, we do have the providers. When all of our providers start, we do a professional headshot of them, and we put them on a website. We have all of the specifics, the particulars, what their practice is, where they're going to be located. Some of them are dual location, so they're going to
Okay.
be at Oxford and the downtown location. So whatever. So we have all of that specific information online, their practice and what location they are primarily operate out of.
Now, what about finances? How do I pay?
Oh,
Or,
that's
do you accept
yeah.
insurances? What if I don't have any insurance?
Hmm.
How is that set up?
That's the million. Literally, ironically, that's the $1 million question, because we have commercial insurance. We accept Medicaid, Medicare, all the MCEs. We actually partner with them. I communicate with them regularly. I actually posted about United Healthcare today on our story. So they come to our locations all the time and let our patients know about their insurance options and the perks available through their program. But we also Care Source, Anthem. We Medicaid. What's not the other one? I'm thinking of MedWise. Sorry, I couldn't
Okay.
think of all of the MCEs. We partner with them regularly, and so we have commercial, not private, all the insurance options available. Just want to make sure I covered all of them, and we also have the sliding fee scale, and that's going to depend on your income and the amount of people in your household. So we
Okay.
have people at all of our locations, and we have the information with the household information associated with the sliding fee scale. We have that at all of our front desks, and any one of our staff representatives or our patient representatives could tell you how that impacts you, but because it's going to be depending on your specific situation.
Now, you said you have four locations
Hmm.
total.
Yeah.
How did they, I know Calhoun was the main location. How did they decide on the other three locations? Was it need or what?
That is a great question. So so as far as the Calhoun location, I know that would have started in 1994.
Yeah, I know it's been there for a while.
1994 is sometime in the 90s, and we were at Three Rivers, and we changed the name from Three Rivers to Neighborhood Health, and then we started to the East Paulding location was in 2014, I believe, and then the Broadway location was just last year, and that
Okay.
was because we already had a agreement with them based on a residency. We were using a lot of their residents in their because they do 3 years, so they were coming to help us with our our women's health program, and it was just
Okay.
a natural transition. And Oxford is more so about the the ugly statistics that exist in the '06, the health outcomes, the women. We want to see mother's child reach their first birthday. So that is primarily what we're doing in that area. It's about access and education and convenience. Because I know we looked at the numbers and we saw that like something like 4,000 of our patients were right in that area, and would be in walking distance if we were able to go to that location. So convenience is one of the main things, but also just we want people in those areas that are suffering, underserved. It's in the middle of a food desert as well. So we
That is true.
cooking classes and all sorts of things and options for the community in a right down the street in walking distance.
That is so true because I know there aren't any doctors in this area, private
Hmm.
practice in this area. You end up either on DuPont
Yeah.
or West
Hmm.
Jefferson, Illinois Road, all
Right.
those places if you want to see a doctor.
Hmm.
And you either got to be on the bus route if you don't have transportation. And
Right.
again, like you said, the Oxford location is in walking distance
Right.
for most people, well, for but just about everybody in that area.
Right.
And it is something that should be utilized by the people in that area. And it a food desert, as you said, and you mentioned something about cooking classes.
Hmm.
What is cooking classes?
Well, I just left with our WIC department. We have a partnership with St. Joe community, and they provided it's through a grant, and it's called the Healing Kitchen, and it's all over our social media. I just put it on our social media story, but it's something that we're doing for the community. It's something we're showing people how to use some of the options or some of the items that you can get through our WIC program, through our vouchers and so it's very affordable, healthier, nutritious way to make meals, and we have all sorts of new recipes that they're showing. I just left the class maybe an hour ago,
Uh-huh.
so it's funny that we talking about it now. But it's just we got two people from our WIC program. One of them is our WIC breastfeeding. She's the leader of our WIC breastfeeding program, and the other one is our WIC director, and they're in there. Getting hands dirty, washing dishes,
Oh,
and
wow.
they're showing people a healthier way and different options that they can make with and healthy, nutritious meals.
Well, good. That is something that our community needs.
Hmm.
And it really is. And how do they find out? I know you said you have it on your
Uh
website.
huh.
And let's say someone does not use computer. They're like
There you
me,
go.
not computer literate.
Hmm.
So how would they
Good
find
question.
out about it?
About our
The different things that you have to offer, your cooking classes and all that, you
That's
know.
that's tough without a computer. That's the reason why we are in outreach. That's why we go to so many events to hopefully reach those people that find out about us through other churches, other local organizations. That's the importance of marketing
Mm-hmm.
and being aware of the community partners that reach the same types of people that we reach. So I'm always in the community as much as I can to make sure we're spreading the word, partnering with churches, getting our information, our flyers out. And a lot of it is just guerrilla marketing. A lot of what we had 2 events over the summer, and we just went out. My director, we just literally went out and we knocked on some doors. And I love those natural conversations that come because when we're in the construction process, it's very loud. It's a lot of trucks, and it seems like it takes forever. So when we knocking on people's doors, they're coming out like, "Yeah, we've been waiting. Like when is it gonna be ready? When is it gonna be up?" So it was a good natural conversation. We want to see them. We want to talk to them, show them that we're real people, and they want to see us. They want to know what's going on. They're excited. So it was so a lot of that comes from us just going out there and knocking on doors, talking, having as many events as we can to spread the word and let people know who our providers are. They're real. They care about people, and they're here. And a lot of people that come to us, anyone that comes to us, is because they believe in the mission.
Now, when you said about events you do, what type of events you do to let the public know that you are there? Because I go to church in
Hmm.
that area. So again, I was one of those people going, how long is it going to take? Are they really still working on it?
Yeah,
and
we
and that, and I do know there were some hurdles
yes,
as it went on. So yes, I do. I was one of those people that watched it
yeah, I
go up
understand.
and everything. Now, have the community been accepted to the program?
Yes, we just started in June,
Mm-hmm.
so that would have been what's this August, October, so
Mm-hmm.
not too many months ago, and we're getting ready to soft open pharmacy, and pharmacy is gonna grand open in June at the top of January. Sorry, I don't know why I said June, the top of the year. So as we're slowly unraveling our services, adding more providers. More and more patients are coming into our facilities. People are being receptive of our community center.
Mm-hmm.
All of the programming that we have, more and more people are coming. More and more people may come and poke their head out. There's a lot of times where I'm over there and I'm outside taking pictures, doing whatever I'm doing, and people come up to me and ask me about what's going on. And cause people are definitely curious. We just want to make sure we're doing as much as we can to provide the programming and the access and be available, so when they're there we can answer those questions, and we make sure when we do open the doors we have something to offer.
Now, you said pharmacy is
hmm
going to open. Will it be just for your patients, or will it be an open pharmacy that anyone can come in and get their prescriptions filled, or how will that work?
That is a great question. I do believe you have to start as a patient and
Okay.
you refer, get, and our provider will refer, because our pharmacists work with our providers hand in hand. I know the Oxford location, I think it's going to take a little while to get, because we have to get our insurance and our payers together, because that works a little bit different than the insurance for healthcare. So that's going to be a little while, which is why we're having a soft open, a little quieter, to make sure we get our all the nooks and crannies out of there, and then we'll be ready to go with that top of the year.
But that sounds good. If a person is there being seen, they don't have to try, if they took the bus to get
Right.
to you, they don't have to try to get another bus to get to the pharmacy to get their prescriptions. So that too is a very convenient thing
That
for the community.
I like how you put that. I couldn't have put it better myself. And that's the point, is to with all of our service lines, and sometimes I even forget to mention that all of our service line is designed to have people with the convenience, so you can maybe even schedule a medical. In the ideal world, you could schedule a medical and a dental appointment in the same day. Or when you go to the dentist, they give you medication. It's right on the first floor.
Mm.
So, and you might have to wait a little bit to get it fulfilled, but you don't have to go anywhere else.
Yeah, waiting a few minutes or
hmm
whatever. If you go somewhere else, you still
Oh
gotta
yeah,
wait
you gotta
to
wait
get it
anyway. Save that
anyway. So
gas money,
you
right?
might as well wait where you are, because I know that sometime I've had doctor call in a prescription and they said, well, it'll be ready at such and such time, and you get to the pharmacy
You
and it's
still
still
wait,
not ready.
still wait.
So you still
Exactly,
have to wait. So
exactly.
that it should not be a turn down that they have to go
Right,
downstairs to wait for their prescription to be filled,
exactly.
because when they leave, they have not only been seen by the doctor, but they have the medications that they need as well to take with them.
That's right.
So
I like how
yeah,
you put that.
that in itself is a plus.
Right.
Is a plus. Now your doctors that are there, where do you get, and I hope I'm phrasing it correctly,
hmm
where do you get your doctors from? Are they within a network per se? Like Lutheran doctors can are in the Lutheran Health Network.
hmm
Parkview are in the Parkview Health System. So how does you would say your doctors, are they neighborhood health network
I
per
wish.
se?
I wish we had that. It sounds good. I like how you put it. Maybe we should do that. Maybe I should talk to our CEO about getting a neighborhood health network. But I would say it's a very, we don't have anything like that. We have I would say we have a blend of young providers and experienced physicians that kind of make it work together, right? So our physicians are going to be there to oversee a lot of things what our physician assistants and our
Mm-hmm.
nurse practitioners do. So we depend on that experience from our providers that's been around for a while to kind of take these people. A lot of our physicians, our physician assistants, our providers are coming out of school, and they
Okay.
need that oversight. So
Okay.
we depend on the physicians that you said. Some of them do come from Lutheran Health Network. Some of them come from that Parkview Network. Our CEO comes from Parkview. So I'm not CEO. Sorry, CMO. So
Okay.
she came from Parkview, and she was very clear that she wanted to give back, and she was in closer to the end of her career when she started as our CMO, and wanted to still provide and still help the community. Very passionate, which is why I say everyone that comes to us is mission, comes to us for the mission. So it's a good, necessary blend of providers with a lot of experience and people that might be just coming out of school and just starting, and they're learning how to see patients and what to do and what type of things to recommend.
Now, do you have like diabetic education? Like if someone come in that is newly diagnosed with diabetes, is there someone to guide them through with what they need to do in that part?
Yes, I can say I've actually worked on things that we have like a diabetes chart for different because we come in contact with people of all different backgrounds. So we have different the chart for what different cultures would eat and that sort of thing. So we have kind of meal recommendations based
Okay.
on different walks of life. So I know personally I've worked on what the meal chart should look like, and so they have a lot of things, and they have walking instructions when they have diabetes. They check A1C. A lot of times our people do stuff like when they hit milestones, they put them, they celebrate them, they take pictures of them. So I know firsthand that no, well, not firsthand because I'm not doing it, but I've witnessed it. I don't want to paint the wrong picture, but I've come around, I've asked questions, and I've been curious about what we do in those circumstances. And I know that for sure they give them walking instructions, and they have them, and they come back and they check the progress, and then they celebrate them when they hit those milestones, and when they don't, they have very transparent conversations with them about maybe, and it takes transparency for them to be able to help you. So it takes like that real conversation. And then some of our providers, I'm sure you know how they're very direct, they're very
Mm-hmm.
straightforward. They care about you, but they're very direct and straightforward and give you the advice you need. And saying it's really about the relationship, but it's also about your transparency and what you do once you decide to leave out of the care and what you doing in between those appointments.
Now, sitting here tonight, if you've been in your position that you are,
Mhm.
what would you say to the community to encourage them to check out neighborhood health clinics?
Well, I would say for one is right there. We've been here for so long, and we started off as a well baby clinic, and we started off accepting we build people based on their ability to pay. That's very similar to the sliding fee scale. So we've been here for a long time, since 1969, under a different name in the community, doing a lot of the same sort of things. So I mean, it's a lot of, there's a lot of, it's a kind of a trendy thing to be healthcare in the Southeast now. We've been here for a while, and we don't plan to go anywhere. We have lots of programming, lots of a variety of providers, and just an option for you to see a bunch of different services under one roof. If you haven't tried chiropractor, if it's right down the street, I mean, why not?
Mm-hmm.
Chiropractic care. If you haven't tried it, why not? We need cleaning, dental cleanings twice a year. Why not go to somewhere when it's right up the street and you can get it based on your income, based on the
Okay.
sliding fee scale. So there's just so many options available through neighborhood health. We're partnering with a lot of organizations, and we have two events, at least two events a year that we put on for the community. It's a lot of fun, and a lot of people come and they're curious about their they're infatuated. Not I won't say infatuated, but they love the fact that it went from an education building and now it's something that we're providing healthcare.
Now,
So
my last question to you,
mhm.
um, is it appointment only? Are there any walk-in services, or how, if someone today needed to come in because of something that happened, are there walk-ins?
Yes, that's a great question because we all of our providers have it mandatory amount of time every day they have to devote towards walk-ins. I think it's 2 hours, something like that. And I will say that if you're a part of that, it's a line for that. So, but there is the option to schedule an appointment, get the best ways to get into on their schedule. But if you have to do a walk-in, we have those available every day as well.
And see, that's good because a lot of places, it is a lot of doctors' offices, they just don't have the time allotted
Right.
for walk-ins, and stuff does
Understandably.
happen,
Right.
and not everybody wants to go to the emergency room
Mm-hmm.
or stat care
Mm-hmm.
because of co-pays and stuff.
Right.
That's a lot higher for
Absolutely.
there than it is. So for to know that they have that walk-in ability. And as our time winding down, is there anything that you have not covered that you wish to let the public know about the Oxford Street location?
Well, I mean, I don't think there's anything I haven't covered. I would say just give us a shot. Just give us walk in, try to meet our people, see what it's like. If you haven't to this point, just give it a shot.
Okay, you want to give us that phone number again?
Mm-hmm.
So,
Go ahead.
so if they need to schedule or they want to talk to someone there.
Right. 260-458-2641.
Now, is that the number for all locations, or, like sometimes you're prompt to this?
Right.
Do we get a prompt for Oxford, a prompt for Paulden, or how do we do that?
Now, there are different, I think there's a different number associated with the Broadway location, but I think the goal is to have that centralized. We're trying to figure that out, the logistics of that, because I understand how that can be confusing to some people. But regardless, if you call that 458 number, 2641, even if you want an appointment at Oxford, they can direct you to the right person and you can go ahead and schedule that appointment over there.
Well, I want to thank you for coming in tonight, sharing with us and the public. And for those of you out there, check out Neighborhood Health Clinic. And I know for a fact, like I said, I am familiar with the Calhoun because it's been there forever, that it is a good place to be. And if you're looking for a doctor in your neighborhood, check out Neighborhood Health Clinic. And as we always say, always protect your mind. And thank you.